You know that feeling when you wake up in the morning and before you even swing your legs over the side of the bed, your knees already feel like rusted hinges? Your hips are tight, your lower back is stiff, and for a few minutes, you're just lying there, almost dreading the act of standing up. If that sounds familiar, you're not imagining it, and you're definitely not alone. Millions of adults experience this exact thing every single morning. That first stand, that careful, slow, almost hesitant rise, has become so routine that most people have just accepted it as part of getting older. But here's what most people don't know. Those first few minutes in bed, before you ever touch the floor, may be the single best opportunity in your entire day to reduce that stiffness. And it doesn't require any equipment, any medication, or even getting out from under your covers. What I'm going to share with you today takes about 1 minute. It's gentle, it's supported, and once you understand why it works, you'll want to do it every morning without thinking twice. Before we go further, this video is for educational purposes only. If you have a specific joint condition, recent surgery, or have been advised to limit movement by your doctor, please check with them before starting any new routine. Now, let's talk about what's actually happening when you wake up stiff. During sleep, you're mostly still. Your joints, which are lined with a slippery fluid called synovial fluid, aren't getting much circulation. Think of that fluid almost like a living cushion between your bones. It keeps everything gliding smoothly when you move. But when you've been lying in one position for 6, 7, 8 hours, that fluid settles. It thickens slightly. The cartilage, which has no direct blood supply of its own, depends almost entirely on that fluid movement to receive nutrients and stay healthy. When the joint is still for too long, that exchange slows down considerably. The tissue surrounding the joint, the capsule, the tendons, the ligaments, also loses some of its pliability overnight. Collagen, the protein that makes up much of that connective tissue, becomes slightly less elastic when it hasn't been loaded or moved. That's part of why that first bend of the knee or rotation of the hip feels tight and resistant rather than fluid and easy. When you suddenly try to stand on joints that haven't been asked to do anything in hours, your body simply isn't ready. The synovial fluid hasn't redistributed. The surrounding muscles haven't been gently reminded they're needed. The nervous system is still transitioning from its resting state, and so that first movement feels stiff, achy, and sometimes genuinely painful. Here's the part that changes everything, though. Joints lubricate themselves through motion. Not aggressive motion, gentle, slow, intentional motion. Even small circles at the ankle, even a quiet bend of the knee while you're still lying flat, starts to pump that synovial fluid back through the joint space. It warms the tissue. It signals the muscles to gradually increase their tone. It tells the nervous system that movement is happening and that the body needs to respond. That process, moving a joint gently to distribute synovial fluid and warm the surrounding tissue, is sometimes called joint loading, and it's one of the most well-supported principles in physical therapy and joint health. The idea isn't new. What is new for most people is applying it deliberately during that narrow window between lying down and standing up. That's what this 1-minute routine is designed to do. Prime the joints before you ask them to carry your full weight. Imagine a woman named Margaret, 67, retired, someone who used to walk every morning but started skipping it because the first 20 minutes were just so uncomfortable. Getting out of bed felt like a project. By the time her body finally loosened up, half her motivation was already gone. She didn't realize that the problem wasn't the walk. It was the standing up cold. The abrupt demand placed on joints that had been completely still for 8 hours and were given no transition at all. What Margaret needed wasn't less movement. She needed a short, gentle bridge between sleep and standing. A minute to wake her joints up before her body had to fully use them. That's exactly what we're building here. So let's go through it, slowly, clearly, so you can picture doing this yourself tomorrow morning. The first thing you do is stay lying on your back, exactly where you are, no rushing. Begin with your ankles. Point your toes gently away from you, then flex them back toward your shins. Do this 5 or 6 times, slowly. This might feel almost too simple to matter, but what it's doing is activating circulation in the lower legs and beginning to warm the ankle joint from the inside. The ankle bears the full weight of your body with every step. It's one of the most mechanically loaded joints in the body, and it often gets absolutely no preparation before you step onto it. This simple movement changes that. From there, move to your knees. While staying flat on your back, bend one knee slowly, sliding your heel toward yourself along the mattress, then slide it back out. Repeat on the other side, unhurried. You're not stretching aggressively. You're just moving the joint through a comfortable range and reminding it what motion feels like. The knee joint relies heavily on the quadriceps and hamstrings to stabilize it. When those muscles haven't fired in hours, the joint is less supported. This slow heel slide gently recruits those muscles and begins warming the knee from both the joint and the muscular side simultaneously. Next, take both knees and bring them toward your chest, as close as is comfortable, no forcing. Hold for a few seconds, then lower them back down. Do this 2 or 3 times. This gentle compression and release serves a specific purpose. It helps the intervertebral discs of the lower spine begin to rehydrate and decompress. During sleep, especially in certain positions, the discs can absorb fluid and compress slightly. The slow knee-to-chest movement encourages gentle spinal flexion, releases tension in the lumbar muscles, and begins warming the facet joints of the lower back. Small joints along the spine that are a very common source of that early morning ache between the hips. Here's something that surprises many people. The hips are often the real source of stiffness that gets blamed entirely on the back. The hip flexor group, a collection of muscles including the iliopsoas that runs from the lumbar spine through the pelvis and down the front of the thigh, shortens significantly during prolonged rest. When you stand without any preparation, those shortened hip flexors pull on your lower back, creating that deep, dragging ache that many people misidentify as a spine problem. Addressing the hips first, before standing, can dramatically reduce how much of that sensation you feel. So while you're still lying flat, let both knees fall open slowly to the sides, like a butterfly position. Then bring them back together. Just 3 or 4 repetitions. This gently opens the hip joint through its natural external rotation range, begins releasing that deep, early morning tightness through the inner hip and groin, and encourages blood flow into the joint capsule. For people with some arthritis in the hip, this is often the most immediately relieving movement of the entire sequence. Now, a practical note about range of motion. Don't chase the maximum. The goal is not how far you go. The goal is how smoothly you move. If the butterfly feels tight at 30 degrees, that's fine. Work with 30 degrees comfortably rather than forcing 60 degrees painfully. The joint benefits from fluid, gentle motion, not from being pushed to its limit on a cold, stiff morning. Finally, and this is the piece most people skip, and also one of the most important. Take a slow, full breath in, and as you exhale, gently engage your core. Not a crunch, not a brace for impact, just a light, deliberate tightening of the muscles across your lower abdomen, as if you're preparing for someone to press very gently on your stomach. Hold that engagement for 2 or 3 seconds. Release fully. Repeat twice more. The deep, stabilizing muscles of the core, including the transverse abdominis and the multifidus along the spine, are among the slowest to wake up after sleep. When they're not active, the spine is less supported during those first movements of the day. This brief core activation starts to restore that natural protective tension before you ever ask your spine to bear load. Now you're ready. Sit up slowly. No lurching, no sudden movement. Swinging your legs to the side of the bed. And here, before you stand, press your feet firmly into the floor for a moment. Feel the contact. Let your circulation adjust. Take one more slow breath. Then rise, using your legs rather than your back to push up. The whole sequence, ankle pumps, knee slides, knees to chest, butterfly hip opener, gentle core engagement, and then the slow, intentional sit-up. 1 minute. Done entirely in bed, with no equipment, before the day has technically even started. One practical refinement worth adding over time. If you sleep on your side, which many people do, especially those with reflux or shoulder issues, do a brief hip stack check before starting the routine. Side sleeping can cause the top hip to rotate forward overnight, compressing the lower back. Before rolling to your back to begin, take 3 slow breaths and let your hips drop level. This small reset takes 10 seconds and makes the rest of the routine more effective. Another practical tip: keep this routine consistent even on mornings when you don't feel stiff. The days when stiffness seems absent are often the days your body is most responsive to movement. Using those mornings to go through the sequence reinforces the habit and continues to support joint health even when you're not in discomfort. What happens over time, and this is where it gets genuinely encouraging, is that consistency shifts the baseline. The body adapts to the signal. Joints that are regularly moved through their range before weight-bearing maintain better synovial fluid distribution. The surrounding connective tissue stays more responsive. The morning stiffness doesn't vanish overnight, but for many people, it becomes measurably shorter and less intense within 2 to 4 weeks of daily practice. There's one common mistake worth mentioning clearly, because it's easy to fall into once you start feeling better. Some people, encouraged by early progress, begin adding more repetitions, more range, more force, thinking that if gentle motion helps, more intense motion must help more. It doesn't work that way in the morning. The joint tissue is still warming up. Cartilage, which has no nerve supply of its own, cannot signal pain the way muscle can. You can overload a joint without immediately feeling it, and the consequence often shows up as increased inflammation and soreness later in the day. Keep the morning sequence slow, light, and brief. Save any more vigorous movement for after you've been up and active for at least 20 minutes. For those wondering about the role of temperature, it's real and worth understanding. Cold environments cause the muscles and connective tissue surrounding joints to contract slightly more, increasing the perception of stiffness. If you wake up in a cooler room, the routine may feel a little tighter than on warmer mornings. This doesn't mean something is wrong. It means the warm-up is especially useful. Some people find that doing the routine with light covers still on, keeping the body warm throughout, makes it noticeably more comfortable. That's a perfectly reasonable adjustment. If you deal with stiffness that consistently lasts more than 45 minutes to an hour after waking, especially if it's accompanied by swelling, warmth around the joint, or symmetrical pain on both sides of the body, it's worth talking to your doctor. That pattern of prolonged morning stiffness can sometimes be associated with inflammatory types of arthritis, which respond to different approaches than mechanical stiffness does. This routine is a complement to good medical care, not a substitute for it. But for the everyday stiffness that most of us feel, that creaking, slow-to-warm-up feeling that fades once you've been moving for 10 or 15 minutes, this 1 minute may be one of the simplest, most consistently effective habits you can build into your day. No medication, no floor exercises, no special mat. Just 60 seconds while you're still warm under your covers, moving slowly and deliberately through the joints that are about to carry you through another full day. Margaret started doing this routine about 3 weeks before she mentioned it to anyone. She hadn't wanted to get her hopes up, but one morning she realized she'd gotten out of bed without thinking about it. No hesitation, no bracing herself. She just stood up. That's the whole point. Not to eliminate what's real, but to give the body a genuine chance to meet the day without being caught off guard. If this was helpful, consider subscribing to Prime Daily Health. We share practical, trustworthy health information for adults who want to feel their best and stay active for as long as possible. And if you have a morning routine that's worked for you, or a question about joint health, leave it in the comments. We read them, and your experience might be exactly what someone else needed to hear today.